When the debate was going on here in Hastings, the time it had done been before was 30 years prior is when it had been brought back up. There's a lot of questions about it then. This time, same questions. Why put it in now? Why do it now? And even back then, it was the same answers back then. It's still one of the best things you can do that saves money. As far as in the public health side. It helps kids mainly from the age of 4 months up to the age of 8. And that's the age when most kids have the biggest problems with decay, which is one of the biggest diseases in children that people don't realize. It's one of the biggest diseases in children that at that age that we have to deal with. And with fluoridation, people want to know why. Why now? And same thing with money and kids having access to dental care. Especially the lower income, has a lot of problems with that. And this is one thing that can help prevent kids at that age, between 4 months and 8 years old, from having a lot of problems. Staying home from school, missing days in school, eating wise, just being healthy in general. And people don't realize that fluoride is actually naturally already in our water. We're just looking to add a little bit more to it to make it to an optimal level that benefits the overall health of the tooth. And that's kind of what we're looking at. Sure, in excess, can you have some problems with it? Sure, you can, but that's with anything. You can have in excess, too much, it can be a bad thing. With fluoride, it's not as big a deal. If you have a little too much, you get fluorosis of the tooth, but still, it's not, the damage is minor. It really is, and people don't realize that. But when you add fluoride to water, you have to ingest lots and lots of water to have problems with that. And most people don't drink, a whole lot of water during the day. A liter of water, one part, it gives you 1 milligram of fluoride, and that's kind of what you look at. But if you think about kids, they don't drink, over 1 liter of water a day, on most days. The problem you see today is that you get one person or a couple people saying something is bad, it causes fear. And fear is one thing that people, when they feel fear, they kind of want to run away from something. They believe the bad stuff about something before they'll believe the good. And I think that's kind of the biggest thing is the fear of what don't we know about something. Today with the internet and so easy to get on the internet and look stuff up, they'll look at more of the bad stuff than they do the good. And I think that's the biggest thing is the fear that they just of not knowing what can happen. I wish I would say yes, there'll be an end, but it might be a while. It's just we tried to explain why, through board meetings and radio conversations, on our side, why do we think this is the best? But it just, some people just don't want to listen to that part of it. They hear more of the negative than they do the positive. And for the kids, it's just, it's amazing that, that this isn't something that isn't looked at in a little more detail. The thing is with fluoride, it doesn't just do the kids; it does do adults also. Like I said, kids is a little more, it does help them, benefit them more, a little bit more, but it is also adults. And if you don't want to drink fluoridated water, go buy bottled water. I mean, that's the other thing that people don't realize, that it's not something they have to do. You can drink bottled water, which most people do anymore. They drink bottled water all the time. But for kids, it's just, with the budget cuts, they used to do fluoride rinses in schools. With budget cuts and money being tight, they got rid of all that. And so, we try to give fluoride tablets to kids as much as we can and do it, but we don't have, some kids just don't have access into coming in and seeing the dentist. And this is one way of trying to help them out and prevent tooth decay for down the road. It really is.